The UN Health Agency warns that because many countries have stopped widespread testing, many cases are likely going undetected. It is urging countries not to drop their COVID-19 protocols too quickly, and it says it's tracking an Omicron variant that is a recombination of two earlier versions. Meanwhile, Ontario residents aged 60 and older who had their first booster dose of a vaccine at least 5 months ago will be eligible for a second booster dose starting Thursday. Wastewater data suggests infections are almost as high as in early January when Omicron was at its peak. BC plans to offer people 70 and up a fourth dose this spring, while Nova Scotia is preparing for its second round of booster shots. Well, joining us now to give us the latest updates on COVID variants and vaccines is Dr. Abhishek Raut, Medical Director at Appletree Medical Group. Doctor, welcome back to Forum Daily.
Pleasure to be here.
So some concerning news here in terms of rising case counts across the country. What do we know so far about this, Dr. Raut?
Right. So the virus level has really been rising rapidly since mid-March. In the past week, it's really going up, and every day we are seeing it higher. Of course, we're looking at wastewater numbers. When we look at the case numbers, what we're seeing is we're currently at about 9,000 new cases and about 4,000 hospitalizations in Canada. In the beginning of January, we were seeing about 40,000 cases and about 4,000 hospitalizations. So still a little bit of a difference, and we've got to watch those hospitalization numbers more carefully.
Another thing to watch out for is this new Omicron variant, according to the UN Health Agency. They're saying it's a recombination of two earlier versions of the Omicron variant. It's being called the XE variant. So what information do we have on this?
We have very little at this time. What we do know is that the data from the UK suggests that XE is likely slightly more transmissible than even BA2, which was more transmissible than BA1. But the WHO has looked at it, and it does need more research there. XE currently makes up only 1% of the total COVID-19 cases in the UK. And there's no evidence so far to suggest that it is somehow immune to our vaccines or immune to natural immunity as well. So some good news in particular. Overall, I think it's a matter of seeing how quickly this can grow.
So should we be at all worried by these rising cases and this new XE variant, Dr. Raut?
Yeah, so I think there's still a lot of unanswered questions around XE, but what we're seeing so far is there's a high level of protection from vaccines and from natural immunity. So it's possible it may be more transmissible, but it doesn't mean that it's more severe. Given the sheer number of infections we've already seen with Omicron, I think we're going to see a fair number of natural immunity there. Keep in mind, recombinant variants are actually very common and they crop up all the time. I'm cautiously optimistic that there's no significant threat with this one. Looking at the fact that it's called the XE variant, we've had recombinant variants XA, B, C, D already, and none have been a major threat or concern. So far, cautiously optimistic there.
All right, Dr. Raut. Well, we mentioned Ontario is rolling out fourth doses of vaccines tomorrow. Just how necessary are these fourth doses?
So what we know now is that this fourth dose could really help people who are frail, people who are at the older end of the spectrum, and people who are at the greatest risk of a severe outcome of COVID. Do we know if it's going to really alter the trajectory of this wave? Unsure at this time, but we do know that it'll help individuals who are most at risk for severe outcomes.
And what about those who are of a younger demographic, Dr. Raut, especially those who may have already had 2 vaccine doses already? Should they consider a third and fourth booster dose?
That's right. For that, we really look at NACI, which is the National Advisory Committee on Immunization. So far, NACI is really recommending provinces prioritize people aged 80 and older, long-term care residents, and certainly the next step is 70 to 79 and moving down. It's still unclear on whether the younger adults and adolescents will necessarily benefit from a second booster shot.
All right, Dr. Raut, a minute left here, but how do booster doses compare to the full vaccine doses, and how could they help in protecting you and others during the pandemic?
It's a good question. So a COVID booster shot is basically an additional dose of the vaccine, which helps maintain strong protection from coronavirus disease, especially severe disease. Protection that you get from a normal dose starts to weaken faster than we thought. Even with Pfizer, even after 5 months, we were starting to see a fade of that immunity. So getting a booster dose helps really extend that protection even against Delta and Omicron variants. So far, we've got multiple studies by the CDC, as well as the Journal of American Medical Association, which really shows that this booster provides a lot more protection against Delta and Omicron variants than being fully vaccinated or even not vaccinated at all.
All right, Dr. Raut, thank you again for joining us for our health segment.
Thank you so much.